COVID-19 exposed weaknesses in our health system, namely disparities among people of color. One issue we've seen for decades, the lack of diversity in clinical trials. Chicago-based Abbott Labs is addressing the problems. Here to tell us how is Dr. Jennifer Jones-McMeans. She is Abbott's Divisional Vice President of Global Clinical Affairs. Glad to have you with us this morning. How are you?
Good, happy to be here. Thank you for having me.
Absolutely. So let's get into this. What are the current racial disparities that exist in clinical trials, and why do underserved communities continue to face such health inequalities?
Well, at Abbott, we definitely believe that diversity and inclusion in clinical trials is essential. As we conduct our own trials, our goal is to ensure that the patients included in the trials are actually representative of those who have the highest disparity in these diseases. And so what we see is that currently among our clinical trials, and FDA actually just released a snapshot of this in 2020 among drug trials that had approved products, that people of color, when you think of African Americans, Latinos, Asians, were still under about 15% of the population of these trials that were used to approve current products. So we see still that D&I, when it comes to trials, there is a disparity.
So how can we create a more inclusive clinical trial ecosystem and address the disparity?
Well, one of the things that at Abbott that we are doing, and we've been very intentional about this, is putting the efforts into training the next generation of diverse physicians and nurses. So at Abbott, what we've done is we've donated $5 million over 5 years to support about 300 scholarships at historically Black colleges and universities that have medical schools, the National Black Nurses Association, and the National Association of Hispanic Nurses. Because one thing that there is evidence to show that when communities see physicians, nurses, researchers that look like them, they are more likely to participate in these clinical trials. And we've seen this in our own trials as well.
What are some of the barriers these groups face enrolling in clinical trials? Is mistrust, distrust an issue here as well?
Definitely, distrust is a main issue, and that is why it is so important that we make sure that our physicians and nurses look like these communities, sound like these communities, as well as another issue that we know is just lack of access. And so one thing that we've implemented in some of our trials is ensuring that patients are able to have transportation services, that they also have the possibility of having home health visits so that they do not need to leave the home, and then a simple lack of understanding of their disease and what a clinical trial is. So we've developed assets such as a website specific for a trial, explaining the disease to the patient, also something that their family can access to understand, well, what are the therapies available to my family member? And lastly, simple things like language translation services. They can be a help to some communities that language may be a barrier to understanding what therapies are available to them.
Driving diversity in medical research. Dr. Jennifer Jones-McMeans, I appreciate your time this morning talking with us. I was going to ask you, I don't know if you can tell us, but any big clinical trials right now going on at the lab?
Well, one of our big ones for peripheral artery disease, so think about the disease of the arteries outside of the heart, is our LIFE BTK trial. So life-btk.com is the website, and that is to evaluate a new therapy. We're working with the FDA on this to treat this disease below the knee that can be very devastating, especially to people of color.
Definitely very important. Again, I appreciate your time, Dr. Jones-McMeans. Have a fantastic holiday.
You as well.
All right.